Okay, everyone. We have Dr. Tim Ryan on the phone, ready to speak to some of the questions around COVID-19 that were not asked by the county commissioners, and maybe, unfortunately, I'm sure I won't think of all of the questions that you might have, but we'll do our best to walk through what's happening now and what we think is going to happen in the future. Good morning, Dr. Ryan.
Good morning, Mark. How are you?
Oh, well, I'm just on top of the world. Thank you very much. But let's start with, and I know you just said it, but for our audience, please, let's start with the facts on the ground as we know them nationally and locally.
Sure. So nationally, what we're seeing across the country is a steady decline in number of cases, steady decline in number of hospitalizations and fatalities. Keeping in mind, however, those numbers began quite high, and so it's going to take quite a while before we get them down to a number that's far more manageable. On top of that, as you know, we are vaccinating a steady course, and right now about 41% of Americans that are eligible are fully vaccinated. That number pops up to roughly 45% in the state of Colorado. But in Colorado, we've seen a similar trend, downward trend in number of cases and hospitalizations. That does not mean we're out of the woods yet. All of the unvaccinated individuals in this, not only in our county, but in our state and our country, is still the majority of folks who are unvaccinated. So lots of potential out there for the virus to move between people. And if this summer is anything like we saw last summer, where everyone moves outside and transmission slows dramatically, that's in combination with the vaccine rollout. That's what we're seeing now in spades and what is driving our numbers down. Similarly, in our county, we're at roughly 49% of our population is fully vaccinated, which is higher than the state and national average. But we are still seeing cases. The majority of these, 95% of these, are in unvaccinated individuals. We did have one increase in hospitalizations over the weekend, and now we're looking to, at our younger populations, those under 12 who are unvaccinated. Unfortunately, those folks are now ending up in the hospital as well. So we have a long way to go. We're nowhere near what we need for herd immunity or community immunity. And if these numbers stay the way they are come fall, we are likely to see a surge once again when school begins again and people go back inside, so like we saw last fall.
Well, okay, I think I heard a couple of things there that I would like to emphasize to our listeners. The first being that there is a great reduction in the number of cases, although they remain high. And by the way, I saw that per capita, Colorado is the highest state in the union right now, unfortunately. But those cases are among people who have not been vaccinated. The folks who are vaccinated are driving down the case load. Have I got that right?
That's correct. So the vaccinated are obviously far less susceptible, and so those driving the numbers and keeping the numbers where they are the unvaccinated. So if you imagine 100% or even 75% of our population were vaccinated, our number of cases, hospitalizations, and fatalities would be fairly lower than they are now. But the unvaccinated are really the pool in which the virus is continuing to spread and to thrive.
And I also heard you mention that a pediatric population of the under 12, and I know that there are clinical trials ongoing by both Mrna and Pfizer, and I'm sure other manufacturers as well. And my hope is that there will be a vaccine approved for emergency use for a pediatric population sometime over the course of the summer, and maybe going into the school year next year, if there could be vaccines required, that would be a big boost to the immunity or our goal of herd immunity.
Right. Unfortunately, the likelihood of a vaccine being available, either Moderna or Pfizer, prior to school starting is quite low. It's, from a timeline perspective, far more likely to be sometime in October when that vaccine might be available for that age group. But it's going to all depend on timing of the clinical trial and how quickly they can get it done. When I say quickly, I mean recruitment of those folks. The trial itself, it will last a minimum of 3 months. It's just a matter of how quickly they can recruit folks to get into that trial and get the data out the other end.
I imagine it's fairly difficult convincing parents of a 3-year-old to enroll their child in a clinical trial. I can sympathize with the desire to keep your family safe is paramount for all parents.
It is, but as you imagine, there is a steady flow of folks who are willing and wanting to move this forward and make sure that age group has vaccine available. My 9-year-old daughter asks me almost every week, "When am I going to get my vaccine? Why do I have to keep waiting? It's not fair." So parents are dedicated to science. I am among them, and so hopefully we can get those kids recruited as quick as possible. And remember, this isn't a different vaccine. It's the same exact vaccine. The only difference is between the pediatrics and adults is really the dosage, how much of the vaccine they're receiving. So it's not a new vaccine. It's the exact same one that everyone else has received. It's just a matter of understanding the correct dosage for that population and how to prevent COVID from occurring.
Just a little bit of an aside, but that's an interesting story about your daughter, and it made me think of, and I can't remember his name or the exact circumstances, but wasn't there a physician in Massachusetts who was investigating cowpox as a potential a vaccine for smallpox, and he took some cowpox and the pus from one of the pustules and infected his son, who almost died but didn't die, and was subsequently immune to smallpox. Does that story ring a bell to you?
Yes, that's exactly right, Mark. I'm not going to be doing that with my daughter, but yes, that's how science used to take place. Lots of scientists, epidemiologists, literally swallowing their own medicine or swallowing their own potential and trying to understand disease spread and potential cure. So it's what happens across the world. Sometimes you have to do what you have in front of you. But here in America, we have the vaccines, and so hopefully those clinical trials can get finished soon.
Yeah, and we've come a long way since those initial cowpox trials. But nevertheless, I just remain hopeful that we'll have that vaccine for the pediatric population before the cold weather really sets in. If it's not before school, then so be it. But let's hope for it before it gets too cold and people are driven back indoors. Okay. My broadest question that I have for you today, Dr. Ryan, is this. We're in this weird spot. We talked about it last week and the week before, but there's a significant portion of the population that is vaccinated, and then there is a portion that is unvaccinated, and then there's probably some strong association between the unvaccinated and the mask-wearing resistant population, and now we have rules in place that say indoors nobody has to wear a mask, but you are advised to wear a mask if you have not been vaccinated. I just don't know how people think they can keep themselves safe? And what is your recommendation for people who maybe have been vaccinated in light of the fact that there are breakthrough cases? Should they continue to wear masks indoors, expecting people who are unvaccinated to not be wearing masks on at least in some portion of that population?
Yeah, it's a great question, Mark. As you know, and I'm sure your listeners know, this was unfortunately politicized long ago, and here we are many, many months later, same scenario. So I'll be quite honest with you. I wear a mask when I go out in public. I try to limit my exposure by going to grocery store and places like that. I definitely wear a mask there. I assume that at least 50% of the folks in the store are unvaccinated, yet you see 80 to 90% of people without a mask on. So those two realities don't go together. So I will continue, as does my family, wear their mask out in public. When I'm outside and able to separate myself from others, the need for mask is significantly reduced. And I really try, if I do have, for instance, a get-together with family or friends, I know their vaccine status, and I feel free to ask people. And if someone's vaccinated, 99.9% of the time, they're happy to tell you that. So if someone's unwilling to tell you for whatever reason they come up with, you can pretty much assume that they're unvaccinated. So I really try to limit my exposure to those folks, and I'm continuing to live life and do the things that I want to do, but just try to limit my indoor exposure to people I don't know. And so I would recommend that for everybody. You know, go out and do your shopping and do your things. Take precautions as you have, but most importantly, really surround yourself with people that you know and trust and you know their vaccine status. It will allow you to have dinner parties again, and it will allow you to do those sorts of things that we haven't been able to do for many months.
You're so right about that. My wife and I had our first dinner party guests this past week, and it was a joy to have people in the house again and to feed our friends and have face-to-face conversations with people that we knew were vaccinated, and also beyond being vaccinated, we know that they are taking the sort of precautions that you just outlined, even though they are vaccinated, wearing their masks in public and trying to avoid people who are unmasked. And it's just a brave new world for us. We're so happy to have had to do that. And I also want to say that I'm taking an overseas trip in 2 weeks on a COVID-tested flight to Europe. Everyone has to have a negative test within 48 hours of boarding the plane. I'll wear my N95 mask despite of the fact that everybody is just tested negative to protect myself en route. And I couldn't have done this had I not been vaccinated. So I just am so happy that the vaccine is out there, and just encourage everyone who is still wondering if it's a good idea. Let me just assure you personally that the freedoms that I have been allowed based on vaccination status are well worth whatever I don't know, whatever you might imagine the implications of being vaccinated and negative implications might be.
Oh, absolutely. It's as others have tried to indicate, there's a huge incentive to getting vaccinated. One, not only do you protect yourself and those around you, but it allows you the freedom to do things that we haven't been able to do for many, many months. So, vaccines are a proven, effective way to stop the spread of the virus, stop the death and hospitalizations in a very, very meaningful way. This is how we get out of pandemics historically, and it's going to be the way we get out of pandemics in the future. So the mRNA vaccines, the two that we have, are absolutely phenomenal in terms of what they've been able to do, how quickly they've been able to generate the vaccines, get them tested, and show that they're both safe and effective, and get tens of millions, hundreds of millions of folks vaccinated in the U.S., but billions across the globe. So,
Yeah, the mRNA vaccine really does fall into that category of miraculous achievements by humanity. I just am so blown away by how great that has worked, how safe it is for everyone, and how, as I read, it is easily manipulated to combat any variants or new viruses that might come along. It really is quite an achievement. Oh,
absolutely. I think it's going to go down as one of the major scientific achievements of the last 20 years, to be sure. Their ability to change the vaccine to accommodate the variants across the planet, both ones that are here now and potential ones coming up, is absolutely tremendous. It's a huge time saver in the vaccine world in terms of development and manufacturing of the vaccine. So it gives us hope for the future. The real challenge now, as you know, is human behavior, and for most of the world, they would literally kill for the vaccine. And here we are in America with more than enough, yet we are only at 50% of the population vaccinated. So, may the strongest nation come out ahead, sort of thing, in the future. We'll see.
Yeah, well, let's talk about the vaccine availability here in Clear Creek County. And by the way, I just want to remind our listeners that it is absolutely 100% free. There's no charge, no cost. You can walk right up to the vaccine distribution sites and ask for a vaccine, and with minimal paperwork involved and your privacy completely guarded, you can become vaccinated and free from many of the constraints that we have been placed on the unvaccinated. So tell us the vaccine schedule coming up, if you can, Dr. Ryan.
Absolutely. So every Wednesday, beginning tomorrow, we will have a vaccine clinic at the Resource Center in Idaho Springs from 10 a.m. to 7 p.m. At that clinic, we have the Moderna and J&J vaccine. In addition, the Safeway in Idaho Springs, Evergreen, and the Walmart in Evergreen all have the Pfizer vaccine. So literally, vaccine is available 7 days a week within 20 miles of anyone's home in Clear Creek County. The clinic, as you had stated, at the Resource Center, it's walk-in. You don't need an appointment. Just show up anytime between 10 and 7, and my staff will be there vaccinating folks as they arrive. And then after June, we'll see how the numbers look in terms of how many folks we get coming in each day, and decide at that point what we want to do moving forward. So, but as of right now, only 49% of our population is vaccinated fully, and 54.6% have at least one dose. So we're actively working now to find and identify that that 5.5% who need their second dose, and making sure that they follow up and get that second dose. The second dose is really what brings you across the finish line, so to speak, in terms of protection. It's what brings you up to 90% effectiveness. Your body is, the one dose in the Moderna and Pfizer is not significant enough to give you that level of protection that is really the highest level. So we strongly encourage folks who've gotten their first dose to get their second dose as their timeline indicates, and or if they've already missed it, to give us a call and get you scheduled. That COVID vaccine line, which is answered Monday through Friday, 8 to 4, is 303-670-7528. That's 303-670-7528. And someone will answer that and help you get your vaccine scheduled and make sure that happens without problem.
Yeah, Dr. Ryan, you mentioned folks who may have forgotten or been unable to make their schedule appointment time for their second dose. Let me just ask you this. I think I know the answer, but is it ever too late to get your second dose?
That's a great question, Mark. Initially we were the advice was you needed that 3 weeks or the 4 weeks, depending on the vaccine you got. And there is a window in there of several weeks, but for logistics, we weren't really advertising that. We wanted folks to get in there. If you've missed that window of your second dose, in your, a month out or 2 months out beyond your schedule, the current recommendation by the CDC is to, in fact, get that second dose. You still have an antibody response in your body, even with that one dose. It is low, and that second dose will bump you up to that higher level of protection that is most important and needed to keep you out of the hospital or from dying.
Yes, and I know that there still are a significant number of people who are being hospitalized, and boy, if you don't think being hospitalized in the ICU is not a traumatic experience, I don't know. You need that shot, and it's that free shot, by the way. I know that there had been some mobile clinics scheduled. What can you tell us about any that might be upcoming or the success of the ones that you've had?
Yeah, we've had some mobile clinics around the county. We had one in Evergreen a couple of weeks back, one in Empire, one in Silver Plume, one up at St. Mary's Alice, and are continuing to do those. We are now really focusing our efforts on the one a week in Idaho Springs and really trying to extend the hours of that so that folks who do work 8 to 4, 9 to 5, still have an opportunity later in the evening to get that vaccine from the resource center. Those hours, again, are 10 to 7, and really going to be focusing on that. We are continuing to do home visits. We've done several dozen home visits around the county for folks who can't get out of their home or homebound. So if anybody knows of any individuals in that scenario, please let us know. Give us a call on that vaccine line, and we will get out there and get those folks vaccinated, and are continuing to do that. So we will have vaccine clinics outside of the resource center in terms of the mobile clinics if the need is there and if we see a demand for that. Right now, we're going to focus our attention on the one in Idaho Springs.
Okay, well, that makes a lot of sense. Now that you've actually been to, let's call it, the four corners of the county, trying to vaccinate people in the extreme outer edges of the county. Congratulations for doing that. I know that we're winding down the actionable items that are happening around the COVID-19 pandemic, and I want to encourage folks to try and keep up to date by watching the website, the county website, clearcreekcounty.us, for updates on COVID-19 as they occur in the county. And I want to extend an invitation to you, Dr. Ryan, anytime to come on the air to speak about COVID. But I know the county commissioners are taking a couple of weeks off. I'm not going to be available for a period of time, a month after that. So we're going to have to probably take a little bit of a break, maybe after next week. But how about you and I talk about having periodic meetings? We can give updates on the COVID-19, and hopefully we're not going to get a big spike in the fall that'll create action items again. But nevertheless, there will always be some information that needs to be distributed. But I also want to start talking about the general health of our community in the ways that you and your staff are planning to utilize the new facility that's being built, the health care center, and the programs that you will institute out of that facility. And I know that you've got a couple of county nurses that you've hired. What do you think? Can we continue the conversation and get into some other issues besides COVID-19?
Oh, absolutely. Yeah, I look forward to that. Yeah, we're excited to move to the new building sometime. The date seems to be moving, so sometime July or August. It's not fixed yet. Once we get there, though, we'll sort of hit the ground running, if you will, with all the other programmatic things that we do. I am excited by the opportunity that we have now. Now we have 3 full-time nurses in the county, which will allow us a lot more flexibility and a lot more freedom in terms of being able to offer more programs and getting staff out into the broader community. It's a lot more feasible with 3 nurses as opposed to the one that we've historically had in Clear Creek County. So I'm excited by that. But we'll be reaching out to the community and being out in the community far more often now with the increase in staff. And, those home visits are really one of the first steps in that process of identifying those folks who are homebound, identifying what their needs are out in the community, and then begin to address those needs with the offerings that we have.
Yeah, I just don't think people realize how critical that is. I will just give a personal story here that when I was a paramedic and I worked on the ambulance, many times we would take someone in for whatever medical condition that they had, and then they'd go to the hospital, they'd have their treatment, they'd go home, and there was no opportunity for follow-up. And sometimes on my own, I would go in and just to do an informal well check on people, and they had been given instructions on to take these medications or to check your blood pressure or whatever the instructions were on discharge, and those weren't necessarily followed through, and sometimes that could lead to somebody having another episode or worse than what they had, and when a simple little intervention would have solved that problem, and I don't think people have an appreciation for having the resources to be able to do those kind of things, do those well checks on folks who are homebound, who might need a little nudge to care for themselves. And that's, I hope, one of the things you'll be able to accomplish with your extra nursing staff.
Yeah, Mark, you're exactly right. You hit the nail on the head. I mean, the amount of effort and energy and money it takes to do those well checks and to make sure that folks are following the prescriptions they have and following the advice of the physicians will save them another trip to the hospital. We'll save them another several nights in the hospital. So from a cost perspective, having that additional nursing staff allows us the ability to do those sorts of things. We're hoping to also offer the school annual physicals for the kids, for their sporting events or whatever they're doing. Our nursing staff are more than capable of doing those exams and allowing the parents flexibility. They don't have to go all the way down the hill to see their physician. They can get that done right there in Idaho Springs and allow them the flexibility in that. So as we sort of wind down on COVID, we're going to be ramping up on those all those other things and really trying to understand what needs are out there in the community and how we can best fill those.
Well, that just sounds like a step that is decades overdue, and I'm glad that we're finally taking that step. And I know that mental health issues will be addressed, and that's going to be a big part of your initiative as well.
Oh, absolutely. The toll that COVID has taken on many, not only financially but emotionally and otherwise, has been quite big. So we're anxious to get out there and to really understand the extent of that and to start to address it in services that we have. And the new building will help facilitate that with the upstairs being sort of a one-stop shop where we have mental health services, we have human services, public health will be there. And then downstairs with the Centura Clinic and I believe a physical therapist there on site as well. So really trying to offer as many services as we possibly can within one building within our county.
Well, between the physical assets that are being developed and the human resources that we have brought into the county, I just am so encouraged at the steps that have been taken, and the future looks much brighter. Thank you very much for all that you're doing in that regard, Dr. Ryan. Listen, I'm going to let you go for now, but if you would like to speak to me next week, you can send me a text, and I'll come in and we can have a little review of where we're at, and maybe talk about any issues that you have on your mind as well. How's that sound?
Sounds good, Mark. I appreciate that. And if I don't talk to you then, you have a great trip overseas and be well.
Thank you for that, and we'll talk to you sometime soon. Goodbye, Dr. Ryan.
Bye.
Oh, boy. Well, I try to make a smooth transition there, but it doesn't always work out. All right, that's Dr. Timothy Ryan, the head of our director of our Board of Health here in Clear Creek County. There's so many good things going on. All we need is more vaccinations. Come on, people. It's a great thing. And it's free. Get on out there, get your vaccination, and join the world fully. It'll be a better world going forward for you and for your family, your neighbors, and loved ones. Okay, thanks for joining us today. We'll be back maybe next week with Dr. Ryan. If not, as I tried to indicate, I'll be out of pocket until late July, and so until that time, here's some pre-recorded music for your listening enjoyment.